behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, Communication is Key in Preparedness. My name is Amanda Bennett, and I will be your moderator for this program. Now I'd like to introduce our speaker for the webinar. Joanne Adkins is a registered nurse and senior infection preventionist for the Patient Safety Authority. Ms. Adkins is board certified in infection control and epidemiology and is a fellow of the Association for Professionals in Infection Control and Epidemiology. Ms. Adkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention and has served on the Member Services Committee, the Sigma Theta Tau International Nursing Honor Society, and the Pennsylvania Association Directors of Nursing Administration Long-Term Care. Joanne, I will now turn the program over to you.
Today's webinar, Communication is Key in Preparedness, will be discussing communicating effectively in emergency situations. During an incident or emergency, communication is especially critical. Well-conceived and effective communication planning can help ensure safety, protect property, facilitate emergency response efforts, elicit cooperation, and instill confidence. There are many communication tools to choose from, and each has its advantages and limitations. But whatever you choose to communicate, make sure that your emergency communications are clear, concise, and are specific with adequate information. So here are the objectives for today's presentation. To discuss the CMS requirements for an emergency preparedness communication plan, to list 3 of the general principles of emergency communication, and to review the 3 areas of required information for the emergency plan. Studies show that during an incident, information is as critically important as food and water. Not only can accurate information mean the difference between life and death, it can provide reassurance to staff and residents that response and recovery are truly underway. So let's talk about the CMS regulation for emergency preparedness, and it is regulation 483.73. This is the part of the emergency preparedness regulations that discuss the communication plan. A long-term care facility must develop and maintain an emergency preparedness communication plan that complies with federal, state, and local laws. The plan must be reviewed and updated at least annually. And the communication plan must include all of the following. You must have the names and contact information for the following groups: your staff, entities that provide services under arrangement, such as physical therapy or maybe your pharmacy, your residents' physician contact numbers, other long-term care facilities contact information in your area, and the contact information for your volunteers. You also, to meet the regulations, must have contact information for the following: federal, state, tribal, regional, or local emergency preparedness staff, the state licensing and certification agency, the Office of the State Long-Term Care Ombudsman, and contact information for other sources of assistance. And then you also must have primary and alternate means of communicating with your long-term care facility staff and also with the federal, state, tribal, regional, or local emergency management agencies. Another requirement is a method for sharing information and medical documentation for residents under the facility's care as necessary with other healthcare providers to maintain continuity of care. And that would be in the instance if you had to evacuate to another facility. You need to have a way to share that resident's information so care does not get missed. The regulation also requires the means in an event of an evacuation to release that resident information. You also need to have a means for providing information about the general condition and location of residents under the facility's care as permitted under Regulation 45. Another requirement is a means of providing information about the long-term care facility's occupancy, needs, and its ability to provide assistance to the authority that has jurisdiction or the incident command center or designee. And the final requirement for communication under this regulation is a method for sharing information from the emergency plan that the facility has determined is appropriate with residents and their families or representatives. So there is some pretty specific items that are required under that CMS regulation, and we're going to discuss some of the ways to meet those. So here are your aspects of emergency communication. Delivering effective emergency communication is an essential part of emergency management. The three aspects of communicating in an emergency are emergency communication challenges, emergency communication tools, and creating effective emergency communications. So we're going to start first with the importance of emergency communication and the challenge it presents. Emergency communications are different from routine communications in several ways, and they require planning. The planning is necessary to minimize barriers. Effective communication may be more difficult during an emergency due to stress, minimal staffing, or a change of routine for your residents that would make them less cooperative. You also have to plan for timeliness. You need to be able to obtain assistance as rapidly as possible from either additional staff coming in or external assistance from your emergency management agencies, maybe your fire department, your local fire department. So you need to plan so that that happens in a very timely manner. And then you need to relay appropriate information. Accurate information that is very clear and specific to the event will help assist the emergency responders for you to obtain the required response. Your initial communication should focus on your immediate need. So the general principles of emergency communications, all emergency communications require, regardless of how that message is gotten across, conform to general principles of effective communication. In a crisis, again, clarity, specificity, and consistently are vitally important. Be sure to present the information in sequence. Present the reason for the message and any supporting information the people you are communicating with may need. Word your message precisely. Make every word count. This is not the time for quote unquote flowery language. Use common terminology that is easily understood by personnel and facilities. Omit unnecessary details. Keep it concise. And keep the message consistent with the various entities that you are communicating with. So that's why communication planning is vital. Planning is vital to rapid, accurate communication. Things to consider when developing your emergency communication plan is your audience. Who are you communicating with? How are you trying to reach them? Is it internal people, such as your staff or your medical providers? Or is it external? Are you trying to communicate with emergency management services or the Department of Health? Second thing to consider is urgency. How quickly do each of those people you are contacting with need the information? And then what is the reliability and the appropriateness of the medium you're using? And what I'm talking by medium is the way you're communicating. I know that in this day and age of cell phones, a lot of facilities would blast out a cell phone text, but what if the cell phones are not working? What if the towers are down? What is the best way you can quickly communicate in that circumstance? So think through when you're doing your emergency preparedness plan and your team is discussing communications. It may be really nice to put in your plan that we will send out a text to all the entities, all our staff to get them mobilized. But then think a step further. What if that's not working? What if during this emergency situation that media is not functional? Or what if there's widespread power outages that affect some of the other sources? So you always need to think of a backup plan. And then the fourth thing to consider is resources. What resources may be required within your facility? Resources could be additional types of media, as we were just talking about, or it could be people. Will additional people be needed to call staff while somebody else is calling the external agencies, such as the emergency management services or the Department of Health? So these are all items to consider when you're reviewing the communication part of your emergency preparedness plan. For an emergency preparedness plan to be functional, it is dependent on current and accurate information. Key to any response is the ability to know who to notify and how to get in touch with them. For this reason, having current and accurate organizational information along with current information regarding key staff is essential. An effective response cannot occur without personnel. The following information needs to be maintained and updated periodically so timely communication and response can occur. And I'm going to break out the information into three separate areas: organizational information, emergency contact information, and external contact information. Your organizational information is the contact information for facility ownership and facility leadership. Your emergency contact rosters, internal, would contain the contact information for supervisors and leaders within the organization, and external would contain the information for your emergency contacts, your contractors, and outside support services such as your fire department, your police department, your EMS services. Organizational information is your facility contact list. On this organizational information, you want the actual facility address and contact information. You also want the contact information and name of the owner or organization of your facility. And also you would want the contact information for your administrator or executive director. And when I say contact information, that is name, address, phone number, cell phone number, and an email. The internal contacts are your staff rosters, both your management staff and then departmental rosters, because you may need to call in additional nursing personnel, or depending on the emergency, you may need to call in additional maintenance or engineering personnel. So each department should have a call roster. And then you should have a family call roster so that when the initial emergency plan is in place and is up and functioning, at some point in time, you want to have a way to contact the families to let them know that the situation is in hand. So when I say a management roster, what am I talking about? Well, the slide lists who you would want contact information for your management roster. And it would start with your administrator and your medical director. And then you would also want your director of nursing, director of environmental services, your plant maintenance or engineering supervisor, dietary director, director of security, safety director, your public information officer, and your social worker. Then when it comes to a department roster, and on the screen is just a slide of one, make sure that within each department, the actual department roster is easily accessible. Staff are educated on its location so they know where to find it in an emergency. And that departmental roster must be reviewed and updated periodically. You don't want to have an emergency occur and find out that nobody has updated the nursing department roster in 2 years. So it should be on the calendar of each departmental manager to update on a routine basis their departmental roster to make sure that the contact information is still correct and that we have the correct employees listed. When it comes to external contacts, that would be your fire department, your law enforcement, local emergency medical services, regional emergency management, your local hospital, your local Department of Health office, the Pennsylvania Department of Health Office of Emergency Preparedness, and your providers, your physicians. Now, I know one of the things that's also important to have a roster for is facility-specific information. And I know sometimes people ask me why we need one more form. The facility-specific information is building information, such as the number of floors, your water source, sewer and septic information, the location of the sprinklers, system control panel, location of power shutoff, and location of generator. Because in an emergency is not the time to try to find all of these items if your fire department would need them in a hurry. You also want to have any known hazards listed, such as propane tanks, high voltage. If your facility is located within 10 miles of a nuclear facility or 50 miles of a nuclear facility. If you have any locked units that would not be easily accessible, those would all be known hazards within your facility. Another facility-specific information is personnel information, such as the facility-wide average number of staff per shift, and it's broken down per department for administration, nursing, dietary, housekeeping, maintenance, and social service. And then the fourth information you will want is resident-specific information. What is your actual census? What is your license bed number and your average census? How many of your residents are ambulatory? How many are non-ambulatory? And do you have any ventilator residents? Those would all be important information for emergency personnel to be aware of. So if we collect this information, what does staff need to be educated on? You need to provide training to your staff on the location of your command center and also of your alternate command center. If you should have a fire that your incident command center is not accessible, where else can staff find the information they need? Staff need to know the location of rosters in the command center and when to utilize them. They also should be aware, and it should be posted, what the command center telephone number is, and staff should be educated on use of media, how to send messages out if it's not something they are familiar with. So here's some tools for your use. What I have today is examples of organizational information forms and rosters, and then of course your contact information for the infection preventionists here at the authority. So this first one is an example of the facility contact list, and this comes from the Alabama Nursing Home Association. They have a prep toolkit online that is shared governance and free for use. And it just is an example of the organizational information showing who the administrator is, who actually owns the facility, that sort of thing. But I want to show you this emergency call list. We were granted permission by Moravian Manor Communities to share their emergency call list with you. And I really like this call list because it's on one page. It's very succinct. It's easy for the nursing supervisor or whoever is initiating the emergency plan to take this one page and just follow the steps. 911, of course, is your first call. Second call for them is to security. Third call is to the director of maintenance. And the fourth call is the on-call RN. At that point in time, they would call on-call maintenance, and depending on what the emergency was, if it's a water main break, or maybe loss of power, that may be all that you need. But if you're talking a fire or some other type of emergency, then the next call is to your nursing home administrator, your director of nursing, and then the CEO of the company. And I thought that they did a very nice job with this, making it very succinct for somebody to follow in the midst of a crisis. Here's an example from the Alabama Nursing Home Administration on an external emergency call roster. At the top, it lists all of your emergency contacts, your fire department, your law enforcement, EMS services, and you can read down through them, the Department of Health. But they also, on this one, then placed at the bottom a table to be filled in for the physicians with both their office number and their cell number. And what I understand, there are still a few that have a pager. But it lists where they can use any of the different ways to contact the residents' physicians. And here's your facility specific information. The number of floors, where your water sources are, sewer and septic source, your control panels, your power shutoff. It's very nicely in one easy to see form, all the information that may be needed by outside emergency personnel coming in. And then, of course, your other tool is these friendly faces that you've seen every webinar now. Our contact information for myself, Christine, and Amanda, the three IPs here at the Authority, are listed below. And you can certainly contact us with any questions or issues or comments you may have. And then we also have been blessed on these webinars to have two of the experts in emergency preparedness, Jason Brown and Pamela Drake. Jason is the Director of Healthcare Emergency Management for the Public Health Management Corporation. Public Health Management Corporation, in cooperation with the Pennsylvania Department of Health, provides management and oversight to Pennsylvania's hospital preparedness program. Jason brings over 20 years experience in emergency response and management, and he has worked and had various titles within emergency preparedness and was also fire chief in the Harrisburg area. Pamela Drake is Deputy Director of the Healthcare Emergency Management for Public Health Corporation. She also is an experienced emergency manager, working both in hospital and the healthcare industry, as well as government, contracting, and university settings. She served as the medical surge coordinator at the Philadelphia Department of Public Health and was the emergency manager at Jefferson University and Healthcare System. So Pam or Jason, do you have any comments to make to the attendees today?
Along your lines of the explaining the situation or providing the early communication, being able to describe how big is big and how bad is bad. Recognize that yes, whatever the event is certainly an emergency to you and your organization, but trying to figure out in the early stages of that of what resources may be needed, what can we pre-plan for. I'm one to believe in the a PACE planning model of I have my primary, my alternate, and contingency and emergency. So the moment that you would communicate that you're experiencing a problem, that's going to shift gears for myself and other staff around the state of what's the next phase of that event? What are the worst case scenarios that could be, and do we have a plan for those worst case scenarios as we move forward? So getting that information of yes, you have an event allows us to continue down that planning cycle, but knowing that you have that event taken care of and you don't need any additional resources is just as important, so we can stand down some of those contingency strategies that we've already started to put into place.
Thank you, Jason. Pam, do you have anything additional?
Sure. So I would jump in and add communication is the thing that is most commonly cited as an area for improvement, whether it's an exercise or a drill or a real world incident. It's one of our biggest challenges and one of the most necessary actions to take in any kind of emergency or disaster. That all being said, I think the biggest piece of advice almost I would share, just from my own personal lessons learned, is really thinking about your audience for the clarity of that message. Who are you trying to get this message to, and what do they truly need to take away? So to Jason's point about how big is big and how bad is bad, that might be a little bit different message to your local emergency management agency or another facility if you're asking for assistance than it is to your employees or the family members. Not that you're going to cover anything up or fib about it, but just the way that you communicate that is going to be a little bit different, because you're always going to want to put something reassuring in there to the families, right, and to your clients and your patients and that kind of thing. So just keeping that in the back of your mind. And my other thing along with that is absolutely work communication into your exercises. Learn from those communications. So I would say really ask for feedback on the actual message that was shared, and develop templates based on that feedback so that you're not doing it in the heat of the moment, right? So give yourself the tools to make your life easier when you already have something unexpected and unplanned going on by saying, I have a bit of a draft. Here's the key information I think I would need to get out in this situation. Add that information in, double check the draft, and then send. So just a little bit of 2 cents there.
Joanne, I'd also take an opportunity to remind everybody that the Pennsylvania Department of Health is a huge organization. While most of you interact with a regulatory body coming out of QA on a regular basis, recognize that the Department of Health also has the Bureau of Public Health, or the Bureau of Emergency Preparedness and Response, sorry, name change. That particular division is, set to help you solve your problems, not from a regulatory standpoint or anything like that. So just recognize that the Department of Health is your regulatory body and you're calling them to explain your problem. It's a large department. There's another whole other division dedicated to providing you the support that you need to ensure that we're continuing to provide the same high level of care that you're used to providing your patients.
Thank you. Amanda, I'm going to turn the program back over to you.
Thanks, Joanne. That concludes the slide presentation portion of our program. Now we would like to begin our question and answer period. It looks like we did have one question about if you would get a copy of these specific pages, and I believe they should have been mailed out to you, emailed out to you before the presentation began.
Also, if you're talking about the forms that I showed as the tools, the links at the bottom of those forms will take you to the Alabama Department of Health's toolkit where you can access those forms. The other form from Moravian Manor, they were very gracious that we could show you their form, but I do not have permission to share that with you otherwise.
Thank you, Joanne. I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation and/or certificate of continuing education, please feel free to direct any inquiries to Shelley Mixel at shmixell@pa.gov. This concludes our webinar.